This cream is used to treat acne and other skin conditions, such as rosacea and seborrheic dermatitis. It helps to relieve the symptoms of skin irritation caused by these conditions. Avar-E Cream contains a combination of two drugs, sulfacetamide and sulfur. Both of these drugs work to stop the growth of bacteria on the skin's surface. Sulfur also has a drying effect on the skin, which helps the skin shed old cells. It is important to apply this cream as directed by your doctor and to use it regularly in order to see the best results. Typically, it is applied once or twice daily, in the morning and/or evening, to clean and dry the skin. Be sure to follow the instructions on the label and consult with your doctor for the best timing and dosage for your specific condition. This cream is meant to be applied on the skin only. The specific instructions for using this product may differ depending on the brand you are prescribed. Make sure to follow the directions given by your doctor or pharmacist. Be careful to avoid getting the cream in your eyes, nose, or mouth. If your condition does not improve or gets worse, be sure to inform your doctor. If you experience mild redness or dry skin while using Avar-E Cream, it's important to let your doctor or pharmacist know. It's also important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, if you do experience skin irritation or scaling, it's important to stop using the cream and contact your doctor immediately. Additionally, using this medication on raw or broken skin may increase the risk of side effects, so it's best to consult your doctor for more information. While serious allergic reactions to this medication are rare, it's crucial to seek medical help if you notice symptoms such as rash, swelling, severe dizziness, trouble breathing, signs of infection, weakness, bleeding, or yellowing of the eyes or skin. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist for further guidance. Before using Avar-E Cream, make sure to inform your doctor or pharmacist if you are allergic to sulfacetamide, sulfur, sulfa medications, or any other allergies. This cream may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. Before using Avar-E Cream, let your doctor or pharmacist know about your medical history, especially if you have kidney problems, cracked skin, or open wounds, especially on the face or hands. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is not known if the drugs in this product pass into breast milk when applied to the skin, so consult your doctor before breastfeeding. When using Avar-E Cream, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Avar-E Cream is skin products containing silver, such as silver sulfadiazine. Be sure to discuss with your healthcare provider any concerns you may have about potential drug interactions. If someone takes too much Avar-E Cream and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to note that this medication can be harmful if swallowed. This medication should not be shared with others. If you forget to apply Avar-E Cream, apply it as soon as you remember. However, if it's almost time for your next application, skip the missed one and continue with your regular schedule. Do not apply a double dose to make up for the missed one. Make sure to store Avar-E Cream at room temperature and away from the reach of children and pets. Do not dispose of the cream by flushing it down the toilet or pouring it into a drain, unless specifically told to do so. When the cream is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.